The phrase new normal has become a catch-all term describing life during the COVID-19 pandemic. For many school-age children, this new normal means social distancing in the classroom, quarantining when necessary, or transitioning to virtual learning. For others, particularly those in economically disadvantaged homes, that could mean foregoing school altogether to take care of other siblings while mom or dad, or sometimes both, works.
My daughter called me one day. She was out on her lunch break and she saw a child probably 5 or 6 years of age walking alongside one of the busiest streets in Tulsa, holding the hand of a toddler. We can only imagine what that's about. Probably a child left at home by themselves. Mom has to work, dad has to work to put food on the table. I have no one to watch my children.
Child development specialist, educator, and consultant Dr. Barbara Sorrells has been working with traumatized children since she was just 14 years old. Experts like Sorrells have been calling attention to the dark side of the education system's normal long before our pandemic-battered education system's new normal existed. She tells VNN trauma from abuse and neglect has been on the rise in the classroom for decades, and teachers simply don't have the resources to deal with it.
They often don't have the spaces that they need to be able to help those children provide what they need in ways that are truly developmentally appropriate versus sending them to the office, putting them in a small room that used to be a closet in terms of, you throw your temper tantrum, it's just one more place to go in and have a meltdown versus doing something that is truly an appropriate intervention to truly help that child learn some skills in terms of how to self-regulate.
Sorrells said brain development is hindered when children are dealing with abuse and neglect.
We know that rates of child abuse are going up, but I also think there's other factors that, in a sense, are unraveling kids. I think preoccupied parents who walk around with a screen 24/7, children who come home from school and from the time they get home to the time they go to bed, they're on a screen. On the weekends, they're on a screen. Relational poverty.
Statistics from Oklahoma Human Services affirm Sorrells' determination that cases of both abuse and neglect have been on the rise, a majority of which are the latter. Substantiated claims have nearly doubled compared to numbers from 10 years ago. Nearly 16,000 Oklahoma children were abused or neglected last year. About 68% were preschool and school-aged children. Has the pandemic been driving an additional increase in cases? Current data indicates no. DHS spokesperson Casey White.
We did see a dip in the number of referrals to our abuse and neglect hotline by about 40% in April, which we attribute largely to kids being out of school and away from their teachers and also out of their usual childcare programs. And then probably also to a smaller degree that children were probably not being seen by doctors, or if they were seen, it was only virtual visits during that time. But then by summer, our call volume really returned to normal.
On a per-month average, White says calls and substantiated reports have seen only a small increase compared to the same time last year. But you may wonder, what about the possibility of a more significant uptick in neglect and abuse going unnoticed due to social distancing? It's a concern for numerous agencies, but White says the old chain of command is still in place, and they can't just start knocking on random doors to make sure everything is okay.
DHS does not have the statutory authority to investigate cases of abuse or neglect outside of that child abuse and neglect referral that we receive to our hotline. So that's one reason that it's so important that we really ask that if you see something, say something.
Districts like Tulsa Public Schools say they are taking extra steps to keep a closer eye on the welfare of children during these trying times, like live Zoom sessions regarding mandatory reporting and distance learning considerations, and specific guidance to school leaders on what to watch for in a distance learning setting. While current abuse and neglect claims don't appear to be out of the ordinary, the level of stress families are experiencing is another story.
Especially if I'm working in those areas of high need, high crime. We know that those families in particular are struggling, and they may be struggling just to put food on the table. It's not that they don't love their children.
Sherry Trice with Oklahoma State Department of Health Community-Based Child Abuse Prevention tells us the decisions families are being forced to make regarding education have also been a large pandemic-related stress trigger.
Virtual at-home learning, I don't think we've figured out yet how to optimize that and feel comfortable with just virtual learning or even sending your children back. I mean, there's such an unknown. I would just say that's my feeling personally.
The Centers for Disease Control has provided a lot of guidance as to how staff and students should socially distance during the COVID-19 pandemic. Recommendations for schools include the use of masks, physical barriers such as sneeze guards and flexible screens, and visual guides to ensure staff and students remain at least 6 feet apart from each other as much as possible. But the risk of contracting COVID-19 in that type of environment has yet to be determined. Experts say a positive relationship between student and teacher is the key to learning, and it could be the only positive relationship a child has. Now teachers are tasked with helping children heal from trauma and strengthening positive relationships with their students in order to effectively teach them, while putting even more physical distance between everyone in the classroom, oftentimes on their own dollar.
I had a conversation with a teacher last week, teaches kindergarten. They have to social distance, but she only has 6 tables and 18 kids. So she ended up out of her own pocket going out to spend her own money to buy lap desks, because there is not money to accommodate some of the special accommodations that teachers are having to make, but that's always been the case. You know, it'd be like expecting our doctors and nurses to supply their own PPE. We would never expect that of them, but yet teachers do that all the time.
Teachers must solve the equation of how to be socially distant without being relationally distant, particularly important whilst dealing with traumatized kids. This problem is compounded by the fact that students have become more relationally distant from teachers for years due to increasing class sizes. The state of Oklahoma is starting to address the magnitude of trauma in the classroom. The Oklahoma State Department of Education has held statewide summits on trauma for the last 3 years, including training for teachers who are typically the first to encounter trauma in kids. Oklahoma Human Services shows out of the 15,809 substantiated child abuse and neglect cases they had in 2019, 1,417 originated at school. Despite this focus, little headway has been made on the classroom workload for teachers, set curriculums, or statewide testing mandates. Statewide standardized tests were suspended last year due to the pandemic. The jury on if they will be suspended again this year is still out. Sorrells tells VNN there are things more important than academics when it comes to child development, at school and at home, like helping children make connections through different experiences and simply feeling safe.
The brain cannot develop in healthy ways. Children can't learn when they don't feel safe. If all you can do is keep your child safe and help them to create a sense of felt safety, hunker down as a family, even if all you're eating is a peanut butter and jelly sandwich, sit down for dinner together, or whatever meal of the day that you are together, sit down together and just read to your child.
There are other serious obstacles preventing some children from feeling safe and actually being safe, like mental illness and or drug addiction at home. White tells VNN DHS is working with Governor Kevin Stitt and the Cares Forward team to launch community hope centers across the state to help strengthen families and overcome those obstacles. We're told the centers will have mental health professionals, Oklahoma DH staff, virtual learning tools, meals and snacks, a weekend backpack program, and others. She says they're also working on developing strong community networks and service-first partners, like a recent partnership in Kingfisher, in which Frontline Ministries offered them 24-hour access to a house where they can provide services to families. Sorrells tells VNN partnerships with community leaders are going to be paramount to helping families during these especially trying times.
Communities, faith communities need to come together to find those children in their congregations that are being left home alone. I know that some churches are rallying to the cause and providing some assistance for children during the day who have parents who need to work.
She says she's heard stories of teachers in North Tulsa reading to children in their driveways so they don't get left behind. Cities are coming up with other ways to help parents too, like Tulsa Park's school support camps, where Tulsa 1st through 6th graders are able to study safely in socially distanced pods instead of being left home alone. Trice reminds people to simply be aware and care.
Such as a tantruming child in public, instead of giving the parent the stink eye, perhaps, offering an encouraging word or offering to a hand if needed, providing support to a family that's stressed. Anybody these days could drop off a meal without having direct contact with the family.
For information on how to report suspected child abuse or neglect in your state, click on the link in this story. Professional crisis counselors are also available 24 hours a day, 7 days a week, in over 170 languages by calling or texting the Child Help National Child Abuse Hotline at the number on your screen.